Hi everyone, this is Sean with the MassSupport Network here with the Massachusetts Weekly Public Health Report for Friday, October 9th, 2020. So we're going to start by looking at cases in isolation, or excuse me, cases in quarantine. These are cases that are being monitored following exposure to COVID-19, but are not necessarily confirmed cases. So here is how things looked last week. And here is how they are today. That is a solid uptick on about 400 additional cases undergoing monitoring right now, which just shows partly about how the virus is increasing in Massachusetts. That's going to be the theme of this presentation. So spoiler alert there, but basically each one of these slides is going to show increase over the last week. So now this is cases in isolation. This is the confirmed cases. Obviously we have the total number of confirmed cases there on the left, the cases who have completed their isolation term and have recovered, deaths, and then finally the cases currently under isolation. Now again, this is what we were last week, and there's where we are this week. So that is an increase of about 1.4 thousand active cases at the moment in the state, in isolation anyway. So again, more evidence of the disease spread there. So looking at our hospital usage has gone up by almost 50 beds in the last week as more people require hospitalization for severe cases. However, ICU use has stayed about the same, and intubations have actually gone down. This is likely due to a, well, it could be due to any number of things. It could be generally that younger, healthier people are being hospitalized, and thus fewer requiring severe or intensive medical treatments, but also ICU cases and intubations are going to trail behind hospitalizations. I would not be surprised to see these tick up significantly in the next few weeks. But also again, with intubations, there are so few of them currently in the state that just given that, I pulled them on Friday, they could vary wildly over the week because there's so few. So that is more prone to changing with just a couple of people coming on or off ventilators. But looking at who is being infected currently, the average age of cases has dropped a year, which is a sign of more younger people being infected. There are still a number of higher education outbreaks we'll look at in a moment. The average age of hospitalization, however, in the last 2 weeks has gone up, in fact, by about 4 years. So again, this is a case where younger people are getting infected more, but older people are bearing the brunt of it. However, the average age of deaths came down about 3 years, and in the last 2 weeks, we saw what I believe is our first ever death in Massachusetts of someone under the age of 20 from COVID-19. In terms of where our contact tracing is at the moment, our total overall outreach has ticked up a little bit, about 0.1% each on the overall scales. But in the last 2 weeks, we are seeing a lower percentage of cases reached total, but of course that is to be expected with a higher case count because we are actually getting more cases and contacts contacted, but because there's so many more existing, that is a lower percentage. Our contact traces are still reaching about 84% of positive cases within 1 day of their test results. So that's still pretty good there, but this is things that as spread increases, contact tracing becomes more and more limited as they just won't be able to keep up with the amount of cases they have to deal with. All right, so speaking of all these cases coming out, let's take a look at where they're actually happening. So this is where we were last week, our last data here. And this, of course, as I was trying to explain each week, the state map shows towns by the daily incidence rate over the last 2 weeks. So that is the average amount of cases per day over the last 2 weeks per 100,000 people. This is where we were last week. Towns that have fewer than 5 cases will not show up on the map at all, regardless of how much that is by population. But then the rest, if you have more than 5 cases, and that amounts to fewer than 4 cases per 100,000 people, it'll be green, and so on from there. So this is where we were last week, and here's where we are this week. So what's I'm seeing happening here is there are not as many new communities showing spread, really. There are a couple, but mostly it is places that already exist becoming more severe, what I would call vertical rather than horizontal spread, if that's a phrase. So we see a lot more red, especially in the central Mass area and the southwestern, or southeastern, excuse me. The west of the state is seeing a lot less there, but that reduced spread there is not as much, not enough to mitigate the total number coming from the eastern part of the state. We've had a big jump in the state daily rate, which was 5.7 new cases per 100,000 people per day over the last 2 weeks. It has jumped up to 7.3. That's the biggest jump since they started recording it this way. So there is a definite increase that way. Looking at percent positivity, which of course measures what percentage of tests are coming back positive. We also had a big jump here as well. We were at 0.87% last week, and now we've jumped up to 1.01% of tests are coming back. Now, obviously, this is still a very good percentage, but that increase is still worrying as our case counts are rising. And that is more likely due to case counts rising than to testing levels falling off, but there may be some of that as well. But as you can see here, even in some areas that were very red in the earlier chart, these are still not getting that darker blue, which indicates a high percent positivity, which means that there are areas where we are targeting our testing very well. So that at least is good, even though our percent positivity is going up and we need to do more to mitigate spread. Places which may be showing some of that spread include institutions of higher education. Checking with those. The amount of new cases has stayed more or less the same. It was 218 last week, and now it's 211. So there isn't a exponential outbreak there, but I think there was some hope that as colleges got going and their bubbles kind of solidified, there would be fewer cases coming from them. But also testing on the higher education level has dropped off significantly. Last week, in the last week, we talked about 200,000 tests. And the week before, it was about 288,000. So we've definitely dropped down on that a lot, which may also mean that we are missing some cases. When about the same number of cases with much fewer tests, generally means that that is a higher percent positivity. There may be more cases that we are missing. And so let's look at the state overall, see how we've been trending. This is the last month of 7-day average cases. So we've had this kind of sharp rise in mid-September here that has leveled off a bit recently, but we are still at our highest in some time. The last 2 days there with the drop-off, there is always some lower numbers in recent days. They're still updating and backdating recent tests that have not come back. So we try to put those to the date they were tested rather than the date the test came back. But you can see that we are averaging just under 600 cases a day, which is quite a lot compared to when we were regularly in the 200s just a month ago. So, this last month has seen, our biggest increase since, April. So we may really be in the beginning of our own second wave here. So that's something we need to prepare ourselves for. All right, so one last thought. I'm going to go out into a 3-day weekend, just something peaceful to take your mind off all that stuff. This is a South African flower that grows in the shape of a rock. It seems to be a rock, but is actually a flower. So it is just kind of a nice kind of Zen thing to look out into your weekend. Of course, I forgot to write down the name, so you're not going to be able to look that up, but just enjoy that there. All right, so for more of the MassSupport Network, you can find us on our website or social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.